For example, a lot of us call insurance company before operations. Uh, if we ask uh, if we ask insurance company to guarantee this process, the patient would be feel safer, like will feel like insured even something happens after the operation, so that the physician wouldn't be burdened. Well, I would like to interrupt Professor Tao. How the humanity can build a better system for the professional healthcare workers. Later, I would ask that later, so I would like to interrupt you. You can save that for later question. Well, the last I put Professor Yuan Zhong in the last. I think you are a great expert, so you are put at the last one to answer this question. I think you have a very good perspective regarding this question. I would like to hear from you, and maybe you can summarize this, Professor Yuan. Well, thank you for introduction. I really want to pay respect to Professor Tao Yong. He has done a lot, and it also reminds me of more than 40,000 medical workers who helped the treatment of COVID-19 in Wuhan. And I think not only the conflict of Professor Tao Yong, but also the pass away of Professor Liang Wen. But still, after those malicious events, our health workers still put everything aside to help Wuhan and to go to Hubei province. I think the disease is a common enemy for us. It should be common enemy for the patients and the physician, and they should be standing on the same side. And the patient-doctor relationship, there is very moral, it's a very large moral challenge. And I think uh, no matter what the patient is, it could have a conflict with the physician. How do we how do we evaluate the moral side and humanity side? It's very important. Well, nowadays, this is a society which sees a lot, which stress the common economic values. We think about lot about money, and there's an example that when the surgeon communicates with the patient, they say that if you agree, I would put everything aside to operate on you. I think that's a very good case of communication with the patient. Well, I used to be a physician myself. There are different ways. There are aggressive ways and there are passive ways. An aggressive way takes a lot of adventures. Well, and I would like the society to give the physician a reason to take the chance, to take the adventure. And also for the physicians, we need all physicians to give the patients a reason to trust. So that's a two-way thing. So for society, for media, and for the public education, we should really raise the public awareness of the medicine. And the past events might have decreased the trust between the patient and the physician. And some of the physicians, they're leading a very difficult life to gain the patient's trust. And I really respect Professor Tao Yong to say all of that. Even though after this traumatic event, he still respects his patients. Thank you, Professor Yuan. I think you have geared our conversation to the trust and the information sharing, these very basic topics. I would like to share with all of you that as a documentary director, we stayed a lot in the hospital. In Shanghai last year, we stayed in the patient doctor relationship conflict room in that hospital. We have seen 100 cases of patient physician conflict. With all these big data, uh, how is the tension? What's the stem of this tension? And what's the proportion of the physician's error? But later, after the discussion, we found out that the error that stems in the physician's error takes less than 10% of all cases. I think medical malpractice is even less than 5%. I think more than 90% is caused by trust issues or communication issues. So we also did an analysis. What's the reason for this loss of trust? I think that's because the Chinese patients, they have a misunderstanding. They have very little information on the medical side, and they also have very high expectations of the prognosis. That's very important for the trust issue. So this is a very common mask. This is just average mask. I think during the COVID-19, there's no effective drug. It's the mask that's these things that have helped us. So during the COVID-19, we say a lot, wear the mask, stay at home, please do not do the public gathering,
This
just
man
so as
who
to
is talking.
decrease the infection.
This,
So this is
I
that's that's a common sense. Why do we reiterate this common sense? That's because we have to educate our public because they have a gap in the medical knowledge. So I would like to ask Professor Luo. I think you're a pediatric physician. Pediatric physician, you may encounter a lot of mistrust in your treatment of child. The gap of information, how would that affect you? How do you see that problem? Well, indeed, as I have mentioned earlier, the patient physician have a gap in the information. So as a pediatric physician, this is more of the case. We are faced with a lot of patients, not only one patient's family member, but also a lot of family members. They might come into our clinic patients. They even telephone us, different family members. They even telephone us to ask questions. So how do we maintain this trust with our f- patients? I think that's very crucial. And Professor Yuan Zhong has mentioned that our physicians, we should give the patients a reason to trust us so as to gain trust. And that caused our physicians to possess more professional knowledge and also a good skill for communication for different physicians, different patients. We need to be meticulous.
For surgical patients, we need to be more decisive. We need to be able to pay attention to dignity during our surgery. So for different patient populations, we need to assess their needs and professionally have better skills of communication with patients and patient families. So to explain costs and prognosis and the causes of the disease. So we need to have better communication before the end result. This will improve our understanding between doctors and patients. Thank you, Dr. Luo. My next question I wish to ask Dr. Xiao. You are an expert on. Are you online, Dr. Xiao? Yes, I'm here. Hello, Dr. Xiao. I know that you are an expert on, you are in the School of Public Health, but you study social sciences, social health care. So this epidemic is a large public health issue. We saw how after the pandemic, people's respect for doctors has raised to a very high level, but I worry how about after the pandemic, will our respect be maintained for doctors? Do we have any challenges in this aspect? The same as you, I am not very optimistic for 3 reasons. The first reason is our society, people's trust between people, that there isn't a lot of trust between people. So trust between doctors and patients is affected by this uh, mistrust between people in whole of society. If there are this level of trust within society cannot be changed, it is difficult to have real changes in trust between doctors and patients. The second reason is there's a few large issues for patients. The first is many people, a lot of people, trust, believe that science should solve all of their problems, and healthcare should cure all of their diseases. But people have this blind trust in science, especially in large hospitals. For example, where in my hospital, patients think that when they come to our hospital, they should be cured. Another aspect is a blind trust in money. People think that money should solve all problems. When patients spend a lot of money on treatment and they have poor outcomes or their patient dies, it's difficult for them to accept. So this is related to the development in the past 40 years in China, into how many people have achieved success through their own efforts. They feel that they should be able to solve all problems. They should be able to manage everything that comes up. So this is a very deep issue that will not be solved in the short term. The third problem is from the doctor side. The previous experts have mentioned how there are problems in patient-doctor communication. There are uh, really present issues in doctors. Many doctors don't want to communicate with doctors. They don't think it's necessary because patients won't understand. Many doctors lack the techniques to better communicate with patients because in our medical education, there are very few courses on how to communicate with patients. The next aspect is also incredibly important is that doctors have their burden is too high. They have too many patients to see and too many surgeries to do every day. They don't have a lot of time to effectively communicate with patients in a way that increases trust. So from these three aspects, I think after the pandemic, during the pandemic, doctors were lauded as heroes. After the pandemic, our doctors will become normal people again. Therefore, trust between doctors and patients, because of these three reasons, there won't be a radical change in the short term. Uh, there will continue to be violence upon doctors. How to deal with this kind of violence, we still need to think about in the future. Thank you. Dr. Yuan, our two frontline clinical workers, they were very candid in sharing their thoughts. As an expert in medical humanities, for doctors, they need to shift from a hero to a regular person. They need to start to face their high burden daily work. Do you have any suggestions to help them? I have participated in several webinars with doctors and nurses. we are very clear on how in the current pandemic we see that the government paid for everything. When the government pays, we see an incredible improvement in patient doctor relationships. But in our daily work, the government does not pay for everything. The hospital needs to make their own money. So I know that previously, what I see in hospitals is that societal support and government support will help to decrease the um, discrepancy between the hospital and patients in terms of making money. So when I talk to young doctors, we need to uh, shift from a system where we earn more by what we do to we earn more by what kind of care we show. So good doctors, we need to have greater opportunities for good doctors to prosper. Uh, the hospital also needs to increase their uh, media exposure. They need to educate the public on a better idea of treatment. Healthcare and public care should be the responsibility of the government. Important sectors in the government should need to discuss how to support healthcare, how to support the good doctors and nurses, including medical insurance changes, revolutions. From multiple aspects, from our government regulations, especially in the stronger departments, we need to help to ensure the respect for doctors and nurses. We had a committee that mentioned how doctors need help. Doctors, they focus on details. They focus on vessels and cells and tiny uh, issues, but they need to learn to see things in the bigger picture. Healthcare needs revolution, but in health, doctors also need to learn how to communicate. In the pediatrician, Dr. Zhang, a pediatrician who was 94 years old, he talks a lot about how to interact with the children's parents and grandparents. And Dr. Jiping Wu from his last publication was The Art of Communication with Patients. In terms of communication, Dr. Lang has has a famous saying, "I may not be able to cure your disease, but I will do my best to cure your disease." So the importance is not whether you actually succeed in curing, but whether the patient knows that you are doing your best to cure. Thank you, Mr. Yuan, for your thoughts. You were also very candid. You touched upon a very basic issue, that is the economic basis for all of these relationships. So I want all of you to share on this issue. Previously, Chinese hospitals in China were uh, earning a lot of money from prescription drugs, but in terms of patient satisfaction or other measures that are difficult to quantify, in our traditional management of hospitals, we have seldom linked patient satisfaction with financial gains. We don't seem to have a quantifiable measure. So in our practical work, do you think this is practical? Whether a doctor treats a patient well, an important measure is if the patient shows gratitude. An important thing for doctors is for patients to express their gratitude. This gives patients a lot of appreciation. Even if the patient was not healed, if the patient's family are truly gratuitous. Mr. Tao's patients say this to him because he is good at communication. But in my understanding, we see in how our government pays for medical care and for simple measures such as a routine cleaning that takes a lot of time and effort from medical practitioners, but its price is set at very low. Is there any way for us as managers in the hospital to better show the work of doctors? And I mentioned the need for government departments to discuss this issue. In many cases, we talk about these issues within our hospitals, but this needs to be addressed by various government departments together within each geographical area. But we are not doing this right now. We are very closed right now. So you are talking about allocation of resources. I personally also agree that many problems that hospitals face, patients think that if they don't see doctors, they blame it on the hospital. If they can't get blood transfusion, they blame it on the hospital. But many of these issues, the hospital is unable to determine these issues. Yes, every dean has government leadership, is working under government leadership. We need to shift these responsibilities from the dean of the hospital to the local government. We have 25 minutes left. We talked about many issues. Our discussion, we want to try to help ways to solve these problems. I want to ask all of our experts if we want to change the status quo, if we want to improve our patient-doctor relationship, if we want to increase the appreciation and the salaries of healthcare personnel, do you have any recommendation? Personally, I think in Shanghai, we had a system to solve patient-doctor disputes through a third party. This was initiated by the government, this system. But in our patient-doctor relationships, can we have more private sector participation? For example, changes in our payment system, not only in the national level, but also in terms of private insurance. So these are personally recommendations that I have. So I want to invite each of the experts to share. this is very close to my heart. Um, from my personal experience in the current issue that I faced, I was not, I didn't make any mistakes medically, but this patient was uh, faced with many difficulties because of his disease. In terms of humanitarian care, I think I didn't give him a lot of hope. So I went to Braille libraries and I connected with several NGOs to better understand the lives of blind people. So this helped me understand that blind people were not within very difficult waters. All of our Braille literature talks about positive and optimistic things. So they are all very optimistic and they want to help people. So I agree with you. I think we should motivate the larger population to help with this effort. So doctors don't have enough time to care for everyone. So we need more foundations and NGOs to um, assist in this process. I have been an ophthalmologist for 18 years. Uh, I didn't know that there was a Braille library, and I've never been to Braille libraries in the world. So previously, I've spent all of my time on surgeries and on technology. I didn't really consider the lives of the people in the future. So we need to be able to uh, let these patients to know that even if their surgery is not successful, they can still lead a beautiful life. This will decrease pressure on all sides. So in the future, I will work on this to provide more humanistic support from the beginning of the treatment in a patient. Thank you. This is a very detailed point, but it is practical, and I agree that there are many sectors in the public will. I am also would like to assist you in your work.
I would like to put it this way. The society want to show more respect to the physicians, and there is something that we can done immediately. And I think Professor Yuan has mentioned that in our country, our medical service in our country is a welfare service because we are giving a lot, and this is also the structure for our medical system. Under this circumstance, I think the most critical issue is that we should care more for the physician and to improve the relationship between the physician and patient. This is the issue for the topic for the government. They should be like investing more in this because our medical system is not only about the structure, the infrastructure, it's more about the human resource. The physicians, they are asking for more income, at least in tertiary hospital, large tertiary hospital. For I have friends working in United States. I understand the situation in United States, also in China. So the cardiovascular professor, for example, he need to see 50 patients half day, 50 to 60 patients, and and people are still asking for more positions to be seen by him. So if you take that into account, if you see 50 to 60 patients half a day, he will be having a lot of emotions and he will be very stressed, and it's very hard to keep cool all the day, all the time. And how much time he has for communicating with the patient, there's only a few time left. So this is the issue of human resource. If we have more physicians, they couldn't have maybe visit two or three patients half a day, it would have much more time to communicate with the patient. It's not only about improving income, it's about improving the human resource. But why we are not having more physicians, like employing more physicians in our hospital, I think that goes back to another question also raised by Professor Yuan. I think this is because the development of our hospital uh, needs that. It needs to really like exploit our physicians, if they put in that way, if I can put it in that way. So we need to improve that situation. On the one hand, we need to use medical educations to cultivate more medical students. And on the other hand, we need to discuss with the hospital and to make them more capable of employing more physicians. So there would be a day where our professors, they need only to see maybe 30 patients a week, and for every outpatient clinic they need only to see 10, maybe 10 patients a day. I think a lot of problems would be solved by that way, and our physicians would be a more attractive professional for medical students. But how is the government going to respond to that? And now we really feel like the government is reluctant to increase the human power, and we have not attained the level to satisfy the need for the society and for the general population, and this is a conflict. So during the COVID-19, I think that's an alarm call for the government, so that they can reflect on the lack of medical resource. Thank you. I think, Professor Xiao, you are very authentic, and you authentically call for the response from the government. And how about you, Professor Luo? I really want to echo all of the comments above, and uh, even we have a second largest GDP globally, but actually it's very hard for us to provide very high quality medical care for our general population, and there's still a very large gap between the need and what we can offer. So also Professor Yuan mentioned we really need a lot of government sectors to invest in the medical management and medical reform. Only by that, only by the attention from our whole society can we really improve our medical resource and to better allocate these resources. And Professor Tao is a really good example. I think we really lack a human resource. I even see physicians visiting 100 patients half a day, and there's no time for us to really communicate with our patients, and also for physicians. The income is not only not necessarily the major recognition. If we can keep our physicians happy, if we can have more patients, if we can keep our physicians happy and make more patients trust our physicians, that's more important. So how does the government improve this environment? I think in the hospital, I do agree. We are very meticulous with the science aspect of medicine, and I do agree that we need to see more the humanity level of the medicine. And I do respect Professor Tao that after his traumatic event, he can reflect on the medical humanity, and he would like to care more about his blind patients. So I do call for every physician to really think that way and to think for your patients. And only after we fully comprehend our patient, and also by the public education, and also by some of the work by our media partners, can we really improve our physician-patient relationship and to improve their satisfaction and mutual understanding. And after this mutual understanding, they can understand that the medicine has a lot of uncertainty, and there's a lot of fields, that unknown fields, and so that they can lower the expectation so as to lower the chance for the conflicts. so I understand in a lot of hospitals that we have volunteers in these hospitals to help with the legal side or to help educate the patient, and I think that's a very good practice. And uh, we need more physicians to speak up, and they need to know more about medical humanity, and also we need the whole society to help us with that. And I think that's our major direction. Thank you very much. Thank you. I do hope that pediatric physicians, you can have more income. I really wish that. And Professor Yuan, please. Well, I do echo with all of that, especially Professor Tao. We need to have more encouragement, more incentive mechanism from the society. I know a physician called Li Xiaoji, which is from Renji Hospital from Shanghai. Yes, I that that physician is assaulted by the patient, and he was later being bring to the police station. And I think he's a very good doctor. He has been in the philanthropy for a long time, and I think Professor Tao is also doing that. I encourage every physician to take part in a philanthropy program. If you're a physician, you can do something for to improve the poverty. If you're an internal physician, you can help maybe diabetic patients. You can do a program about that. If you're a neurology physician, you can also do some programs to help stroke patients. And they can really allocate this resource to help his specific patients. So I think alleviating poverty is very important. If even if you are a surgeon, if you are doing operations, you can maybe do some free operations for poor populations, and I think that's very important. And for every hospital, you need to have funds to really help your patients, and that would be a very good gesture. You can take some money aside to set aside this fund to help your patients. I think that would be a very good thing. And not only Professor Li Xiaoji, but also Professor Lin Feng. He has donated a lot of money. I think there's more than 30 million RMB for the philanthropy program. And these are all very successful examples. So for these patients, we respect them a lot. So if we can have more philanthropy programs in our hospital, more physicians can take part. You can see some philanthropy programs now online, and we can devote to that. And I think maybe more programs can encourage our good physicians to take part in, and we should really mobilize the hospital to take part in, and also the government should support. I think medicine is a very good science. We need a lot of effort, and we are facing the death. The physicians have a lot of respect from the society, and we shouldn't be like merchants or entrepreneurs. We should be like physicians, and to go back to our nature. And I think I think we should really focus on that. And the insurance and the funding, these are like really investment in the medical humanity. And I think it's not only about singing or dancing, it's about real money in that investment. Well, you have mentioned the philanthropy, and I think we have several programs. You have mentioned the examples of pediatrics and endocrinology. Myself, I do pediatric endocrinology. We have a lot of philanthropy programs on pediatric diabetes. And I understand Professor Tao Yong, he has done a lot of philanthropy programs, for example, to treat a cataract patients, very poor cataract patients, to do free operations for them. And I think there are a lot of physicians they are going into these programs, and I do call for all the society and also directors or media persons like Director Zhou, and to help us to do publications so as to be known for the whole society. Thank you very much for your input. And think after listening to your answer, I think for physicians, this is a role that we should be practicing for perfection, and I think we are bearing a lot of pains already, and we should lead more positive roles in this career. And I have discussed with several physicians, as you have mentioned, after the COVID-19. Are we going to respect physicians more so as to refrain from conflicts? Can we refrain from traumatic events? I think the answer will be no. But we also shouldn't be discouraged by single events, and we should not. Our faith should not be shaken by these individual events. That's because the physician is a very good role, very good career, and there is a nature requirement for physicians to really care about our patients, and this is the fundamental role that the physician plays. Well, also on behalf of the patient and also on behalf of the media society, I thank you all to give us this power to the whole society. We have very limited time, and this second panel has drawn to an end. And hopefully, after the meeting, we can communicate more, and I can maybe there's something I can help. I'll hand the floor back to Jen. Thank you all. Well, thank you all of you. Thank you, Professor Zhou, Professor Yuan, Professor Luo, Professor Xiao, and also Professor Tao Yong. And indeed, Director Zhou, on behalf of the patients, on behalf of the media society, thank all of you. And for me, I would like to speak on behalf of the public health society, and maybe also as a patient's family member, I would like to thank all of you. I think you are faced with a lot of difficulties. You have invested a lot of your time and effort in this career, and Professor Liu Yanli has mentioned that we, a lot of talents are in this field, and you have spent a lot of time and effort. But now, when you enter the medical society, you are entering a lot of pain. But this should not be the case, and the physician-patient relationship should be that of a family member relationship. And through your discussion, we have understand a lot of cause for the conflicts nowadays. And also, I'm very grateful that you have shared a lot of examples and a lot of advice to improve this relationship, especially under the setting of COVID-19. And also, uh, after COVID-19, I think the general public could have a much more understanding of the physician's role. Mm, Even though this cannot be or be the constant situation all the time, but I think all the society can put in more investments to care more about our physicians, and also maybe we can do something for the system, do something for the public educations and the communications. We can all contribute. Thank you. Thank you all. Thank you all of you to participate here. And this is the end of our symposium today. And I would like to remind you that since 19th May, we'll enter our last week of study, and it's about the media communication and the role that physicians play. This is the topic for our next week's clinical course. Well, the next would be from Toyota. Uh, it will be a satellite meeting. The topic about that is pediatric treatment under the COVID-19.